Alright, so we have a 59-year-old male found at home in the garden by his wife with slurred speech, noted to have right-sided face, arm, and leg weakness. Blood pressure is 175/90 in the field. Blood stick glucose is 122. Alright, so we do want to rule out, the big bad stroke. This EKG is throwing me off. Can we even speak to him? Let's see. Okay, no. Alright, let's do some physical exams. Actually, right away, so I'm going to check his airway, breathing, circulation, cardiovascular, like pulmonary, musculoskeletal, neurological, of course. 2 to 5 strength in the right face and arm, 3 to 5 in the right. Okay, leg, cardiac, no murmur, okay. Alright. So what we do want to do is an ECG, so check his rhythm, because this doesn't look right. And then, just recheck his blood glucose. I'm just trying to explain things as we go. And then we do want to do a basic check his electrolytes and everything. And we want to do a complete blood count. So if there's infection or something like that. Do we want to do a coag panel? I'm trying to remember when I was shadowing the emergency room when there were stroke protocols. What would you do? I'm pretty sure it's the coagulation panel. And then I see some people do order troponins with it, but I don't know. I don't know. I've seen people order troponins. Anyways, you also need a head CT. And then we will perform those. Okay, so he has AFib. So you can tell it's AFib because it's irregularly irregular. So there's not really a pattern to anything in this ECG. So that's what we call irregularly irregular. Yeah. Everything else looks fine. Let's check the CT. Normal without evidence of mass or hemorrhage. Okay, so I'm thinking of more like ischemic stroke. So, you have a blood clot that went to your brain and it's just cutting off blood supply to that part of the brain. And AFib can actually cause there to be clots, especially if it's undiagnosed and you're not on blood thinners. I know he can't. Okay, so you could talk to his wife. He was fine 30 minutes ago before I found him, acting odd. So I guess he was normal about an hour ago. He's never had a brain tumor or stroke or anything like this. He hasn't had surgery recently. He doesn't have any blood thinners. Do whatever you need to fix him. Okay, 30 minutes ago. So that means we can give him TPA. Let me just talk to neurology real quick. Yeah, for definitive treatment. So before giving TPA, I guess I should have got this ready. I don't know. TPA can cause you to bleed. And we do want to do a blood type and screen, just in case we have to give him blood. Any more? Okay. And so, interventions, do TPA. And TPA is like a thrombolytic, like an agent. And so it's going to break down clots by converting, it's going to break down clots by increasing the conversion of plasminogen to plasmin. I'm pretty sure. And that is going to break down the fibrin clots from cross-linking. I think that's right. But if that's wrong, I will double check and add a note. Everything else. So we gave him TPA, right? Or did I not do that? Okay. Oh, it's planned, but it's not performed. It's starting to improve TPA administration. I don't think it's that fast, but I would like to touch neurology one more time. It's probably just want to admit. Yep. Okay, and then the diagnosis would be, I'm just gonna put stroke, ischemic stroke. Yeah. And so there was no hemorrhage on CT, so it wouldn't be hemorrhagic, and you would not give TPA if it was a hemorrhagic stroke. Admit to floor, discharge. I'm trying to think if I forgot anything that we need. I don't think so. Yeah. I think I'm gonna just go with that. He probably still can't talk. Yeah, okay. So that's what I will go with for now. Let's see how I did. Hand off. Finish. Did I not press admit to floor? What did I press? What? I put admit to... admit to ICU. Yeah. That's completely my fault, yeah. So he should be admitted to ICU, not the floor. But other than that, I think everything else went pretty well. I wonder if you do order troponin. Well, they don't have it on here. All right, well, here is the detailed discussion. I will just go through everything. Yeah, so an MRI can be it'll just take too long. And it's not indicated prior to TPA or TNK. I think people use TNK now more, based off some studies. Thrombolytic, yep. Here's contraindications of TPA, and it should be hemorrhagic stroke somewhere. Anyways, if they're bleeding, don't give them, TPA. Or if they had like recent surgery or something, yeah. Yeah, and obviously, if you're on anticoagulation use, you want to be careful. But yeah, I should have admitted to ICU, which makes way more sense, and not the floor. But I hope you guys enjoyed the case, and thank you.